Okay, we on. We
Just
on.
setting up meeting for Facebook Live.
All right.
All right.
I forgot my water.
Okay, it's still loading. Hold on, let me just see if it's. I'm just going to our page to see.
Did people check their stimulus check thing?
I'm not eligible. No.
I don't qualify.
Okay, we're live, guys. Okay. All right. So thank everybody for tuning in. My name is John Ferretti. This is a Local 100 Fightback Coalition live stream about the coronavirus and the some of the aftermath of the crisis that we're all facing. Some of us have faced that crisis very directly. And so we want to try to lead off with people's experiences amongst our own coalition and just talking about what some of our members are facing. So Anthony Steiniger is going to lead it off for us, talking about his experiences. So Anthony, the floor is yours.
Thanks, John. I'm Anthony Steiniger. First of all, I want to express my condolences to anyone who has lost a family member or a friend to this virus. I'm heartbroken. Many of our coworkers have passed. Many of them I've known personally, and it's sad that we will no longer have their presence here. But my experience with this virus is I contracted it. I first started showing symptoms on March the 18th. I went to work that morning and I was feeling fine. Came home that afternoon, sitting in my living room around 5 o'clock, and I started to have a sore throat, and rapidly it became where I was losing my voice. I didn't have a voice. I wasn't able to speak, had difficulty swallowing, drinking. By about 8 o'clock that evening, I had the worst headache I've ever had in my life for the next 3 days. I went to my doctor the next day. Well, I went to City MD. They tested me for staph infection, strep throat, and the seasonal flu. But they didn't test me for COVID-19. They said that if I needed to have a fever over 100.4 in order for them to test me. Well, the very next day, Friday, I had a fever of over 102. And when my wife called, they couldn't guarantee that they would give me the COVID-19 test. So I saw my doctor, and he put me on medication. Prednisone and zithromycin was the medication that he put me on, and Tylenol for the fever. And I got tested. My whole family. My wife was very ill. I didn't mention that she was very ill. She has asthma, and she had to take more medication than I had to take. They gave her a nebulizer in addition to other antibiotics. For a while, I wasn't really sure whether or not my wife was going to worsen and she would have to be hospitalized, or whether or not she was going to make it. This virus really overwhelms the immune system very quickly. And personally, from my own experiences, it was the sickest I had been since maybe I was about 10 years old. So that's maybe about 35 years, 33 years since I had felt that bad. But we were able to get tested through the New York State Department of Health on the 24th. And we didn't get our results until like a week later. And my entire house, my wife, my son, and myself, we all tested positive for the virus. Now, today is April the 15th, and I am still exhausted. I don't have a fever. I'm not coughing anymore, but I'm exhausted every day. And I know, well, I can't say for certain. I can't prove it, but I believe I contracted this virus at work. And just the thought, the psychological, I will use the word terror, or the anger, the sadness that I felt knowing that I probably was the one who brought this back to my family from my job. And I know this is what a lot of us are going through as well. It's like you want to come to work. You have a sense of duty. You have an obligation. I mean, you took the job. You want to come to work. You want to do your job. But at the same time, you don't want to die. You don't want to bring home something that's going to infect your family members with a potentially deadly disease. I don't wish what we went through, and I know what we went through isn't as bad as someone who's actually lost a family member, or some of you who may have family members who are in the hospital now, who are on respirators. But I wouldn't wish what we went through this past 3 weeks on anybody. The TA should have done more to protect us. They should have implemented their own pandemic plan. A lot of, planning for a pandemic really isn't new. It's not rocket surgery. It's not science that you need to study years or have an advanced degree to master. We have over 150 years of germ theory and its basic biology. And you contract these diseases from other people, from surfaces and from contact with other people. And this was known. And as far as the protocols that they say were in place, if you're a transit worker, a train operator, or a conductor who's watching me on this video right now, you know that you go into a bathroom in a crew room and you're lucky if you find paper towels. A lot of times you're lucky if you find soap. Some terminals, there isn't hot water for weeks or for even years. In some terminals, you don't have hot water. So how can the TA say that they implemented, protocols? You can't even wash your hands properly at most terminals. We're coming off the trains. You cannot wash your hands properly. And how can they say they implemented protocols to protect us when one of the first things that was known about this virus was that it could be contracted from being in contact with contaminated surfaces, and the services that we, the employees, use on a regular basis are not being cleaned regularly or in a manner that could prevent us from contracting the virus or coming in contact with a contaminated surface. I don't really know how to state or really, how to convey the anger that I feel when I see, people who aren't on the trains say that they've done enough to protect us when they're not there. When it's easy to say this from the comfort of your own home or from the safety of an office where you're, to put it another way, if you're an office worker, how many people touch your desk each day?
Yeah.
Maybe just you, maybe a couple of others, but that's your workspace. Our cabs are touched by many, many, many people just in the course of a few hours. In the course of 5 hours, the controls of my train may have been touched by like 7 or 8 other people. In the course of 24 hours between that train going up and down the line, maybe going to the yard, wherever it's gone, it could be upwards of 15 people who touch the same surface that I've touched. Cleaning it 72 hours even if they are cleaning it every 72 hours, is just not enough to ensure that we're not touching a contaminated surface. But I'm going to let the rest of the coalition members talk about their experiences. I hope what I said helps some of us. But what I'd like to see is widespread testing of all of us. Every single transit worker needs to be tested for this virus, whether they're asymptomatic or not. Every single cab needs to be cleaned after every single run, thoroughly disinfected and sanitized after every single run. If it's possible, isolate the cars that are the operating positions of the conductor and the train operator. That's the only way that you'll really have some decent protections against contracting this virus. And even though I've had it and I am recovering, the science really isn't known as to whether or not I can be reinfected. I mean, there is some studies that say that people have antibodies that may prevent them from being reinfected, but until there's a reliable antibody test, and that test is widely available, I really don't know whether or not I'm going right back into the cauldron. But I will return to work. It's my job. And I'll try and follow my own safety protocols, because there's nothing really there that transit has done for us that will ensure us not being infected. But I'll pass the baton to Umberto.
Okay.
So that he can talk about what his experience is.
Thanks, Anthony. I appreciate the commentary. Also, give your wife a shout. You know what I'm saying? Continue healing, feeling better.
Absolutely.
It's been, not only is it a physical strain, it's an emotional strain for all of us. And
Exactly.
my name is Train Operator Rodriguez. I'm a train operator on the Mikey line. I'm a switchman. So at the beginning of March, actually, my wife gave birth to our first child. So after my 2 weeks of paternity leave, I resumed to Metropolitan Terminal as a switch person, and from there, I guess, is when everything started. And I was a switch person. I actually had to pound the road because crews were going out. People started getting, people didn't have answers. People were getting scared. People were getting paranoid. People were starting quarantine. All we had was, I think, the sanitizer, the state issued sanitizer, and that's it. And they weren't even doing protocol in terms of like the crew rooms and the dispatcher's office, which we don't discuss. Like, a lot of our dispatchers and tower operators have been getting sick, and we haven't addressed that. And they're in close quarters. A dispatcher will see 50 crews, in the span of a day. So they didn't have anything in place for them. I don't know if you've been to Metropolitan. Our locker room is our crew room. It's very tight quarters. So this is a vector for the stuff to spread. So luckily, I had put in for time off because I had a child, and my wife was very scared because she's like, well, we just had a baby. She has asthma, and she's like, you need to get home. Like, I was like, well, I have to work these X amount of days so I can go back on my vacation. So she's scared. She's scared now. She doesn't turn. Like, I don't know what we're gonna do, but we're gonna have to face this. But the COVID has exposed a lot of issues that we have, whether it's macro or micro, whether it's the government, whether it's healthcare, or it's transit. Like I was saying, the crew rooms are too tight. The dispatcher's offices are too tight. They clean the train every 72 hours. It's because they don't have the manpower. They rather pay 500 cops to patrol the stations, but they can't hire cleaners to clean crew rooms, to clean stations. You know what I'm saying? It's ridiculous. Like, this thing has exposed everything. Like, the crew office fell apart, so they couldn't assign anybody anything. Nobody knows what to do. Nobody knows who to call. Like, at one point, you had to email if you want to talk to the crew office. Like, they had no protocol for long distance or whatever you call it. Outside of the office for the crew office. Like, it's just 2020. they should be able to work remotely. Like it just exposed everything, like the crew office, the Mac Center, and even the COVID hotline, which people saying they're calling and it takes them hours to get through just to figure out, and nobody knows the protocol for resuming. People are scared. People don't want to go to work, and then amongst the craziness with this, it's the trauma. Like people are seeing their coworkers, people we spend our days with, dying. People that you break bread with, they're dying or they're sick or you don't know what's going on. So it's like people are dealing with trauma, and that's another part we're gonna have to deal with the PTSD when we resume work. We're gonna come back to work, and we're gonna lose. We already lost coworkers. We're gonna have people that we work with. They're gonna be gone, and we're gonna have to deal with that. Like, I know Aetna has a mental health hotline. I think we can post that later that you can call. I don't know if people are utilizing it, but and I just had a baby, so that we can talk about the healthcare issues and our health insurance, and it's lacking, of course, but there are resources. Like I'm not going to complain. Like the process of having a child through Aetna, was pretty good. I can't complain. So it's important that you use your resources more than ever. Like we need it for physical health and for mental health. Of course, the system is right now is damaged because of COVID. Like people don't know where to get tested. The hospitals are turning people away. You have to be literally on a deathbed to get a test. You know what I'm saying? Let alone to get admitted to the hospital. But it's been a trying time for everybody. And like I said, definitely I want to give rest in peace to all our coworkers, and also speedy recovery to our coworkers who are dealing with this, dealing with the physical aspect, whether it's them or a family member or coworker, as well as the mental aspect, like the duress, and then people are on Facebook. We want answers. People are complaining. People are ranting. It's not even complaining. People want answers. So I think it's unfair to be like, well, you need to stop complaining and stop whining. Like, no, people want answers. We don't know what's going on. We don't know if the PIC's going to start. People saying, well, what do you care about your money? Well, we got to pay bills. Like some people have partners that are out of a job. You know what I'm saying? Like we still have to buy things. You know what I'm saying? We still have to pay for stuff. Like nothing's gonna, we still need our money. Like we're risking our necks for this firm, and they can't even pay us. Like timekeeping is behind on overtime. It's like, come on, people saying, well, don't complain about that. Be happy you're alive. And it's like, no, like, like we have to pay. We have to take care of our families. Some people don't have extra income. It's crazy out here, man. This COVID has exposed everything, man. Like I said, whether on a macro basis or on a micro basis, like it's bad out here, man. But like I said, we got to keep hope up and what I'm saying, take care of each other more than anything. But also use your resources, whether it's like I said, it's Aetna, and then also we got to protect ourselves because TA they've been slow to protect us. Now they're finally starting to come around to try and help us. They're of course doing the PR campaign to fight back against all the reports of death and carelessness on their part, and they have to be called out on that. We have to hold our leaders accountable after this. Like we can't return to normal. People saying, well, when we're going to go back to normal, there's going to be no normal after this. We have to change things, man. Like it's been crazy. But anyway, I'm gonna pass it off. I know we're trying to keep this short and concise and to the point, and everybody be safe out there. I hope to see y'all, you know what I'm saying? And take care of your families first. Your families always come first. And hopefully, we can overcome this. Everybody be safe out there.
Okay. Yeah, Umberto, I think we lost some of. Oh, here comes Steiner. Go back in. Hold on. I'm trying to get. Oh, you're back in. Okay. And we're
waiting for Seth.
Missing Seth. I don't know what happened there. All right. So in any case, I guess I'll try to fill some time here. I was planning on going on the end, but gotta go with the flow. So yeah, I was just actually at a protest today. With nurses who are fighting over PPE and basic staffing levels. And, like I know a lot of members, we think that we're alone, but you're really not. Like for real, like the things that these nurses are going through, I couldn't even imagine, like the psychological trauma, like Umberto was just talking about. I mean, your coworkers die, your patients die unnecessarily because they don't have the ventilators they need, because they don't have. Okay, actually Seth is coming back in here. Let me just put him in. So they don't have the basics of materials. Like you have nurses wearing trash bags to protect themselves. I mean, like I cannot tell you like how disgusted and how outraged that makes me feel, how angry that makes me feel, that somebody who they laud on the media as heroes, you know, like they do the same with us. But I mean, like, just think about like how completely disgusting it is that, you know, you have Mount Sinai bosses, the people who run these hospitals. I mean, they're not far from the only one. They're in their mansions in Florida chilling, you know, like, and our bosses, what's the difference between our bosses and theirs? They have the same attitude. You know, our lives are expendable. They walk right over our dead bodies, and they have their press conferences about how great our sacrifices are and how much they feel our pain and how much they sympathize with our families. And then, you know, even most recently, like, you know, management was looking to knife people who died of COVID-19 and say, well, no, we don't have to pay you the $500,000. It's in the contract. It's in the contract. There's no doubt that they were owed this money. So they go through this farce with the union so the union can claim that they won something that we already won. It's in the contract. There's no victory here for this. This is something that they were contractually obligated to provide. So, you know, like, I know that members are scared, and I know that people feel like we've been abandoned, but we have to look at the wider picture that workers all over this country are fighting back. You know, you see Chris Smalls and Amazon and the heroic struggle that he led. I mean, this person, he lost his job. He lost his future because he couldn't live with the consequences of a racist like Jeff Bezos, who literally looks to steamroll workers and exploit them all over the globe. And, you know, he took a big risk in taking that step. But a better world is made by people making those steps. And we have to, you know, we have to not get lost in the misery and in the isolation that people feel and the anxiety that people feel. We have to try to look at the wider picture, and that there are heroic and inspiring struggles going on. And transit workers need to look to those examples for what kind of what kind of actions we need to take and what kind of perspective we need to put forward, you know, in terms of militancy. You know, like, I know a lot of transit workers don't realize, like, for example, the power that we have legally and contractually to fight back on a lot of these things. And because the union leadership has been missing in action, has just done very little to even keep members informed, like the most basic things. This is the baby stuff of leading a union. When you are an officer, you take an oath. You take an oath to uphold representing members in a way that encourages confidence in the union, that encourages confidence that they're not alone, that we're a union and we should be united. And, you know, you see Cuomo and company, whatever you want to say about their press conferences, most of it is dribble and public relations. But at least every day they are providing information for our members, for the public, for members of society. You know, a lot of it is disinformation, but we're getting no information from our union leadership. And so we have to come to grips with the understanding that we are alone in this, that there is no rescue coming, and we got to be there for each other. So when I was talking about the state protections that we have, look, every one of us is infected. Every single one of us has come into contact with this disease in one way or another. It's just so obvious. They continue to run this system for a month now, and it is nothing but an incubator and a mass transmission device for this disease. And they know it. And they didn't even follow their own basic plans. They had a plan back in December of 2012, a pandemic plan that outlined everything they were supposed to do. And because Trump said they didn't need to, they said, okay, we'll go with that. They have contempt for our lives. They loaded the gun. They're playing Russian roulette with our lives. And we need to take what actions is necessary to stop them from doing that. So if you have come into contact with somebody who has symptoms, you need to book sick further notice. You need to contact the doctor and get them to write you a letter to quarantine you. Protect yourself and your families. TA won't even think about you. They won't have a second thought after you're gone. And they'd be more than willing to transmit this deadly disease to your family and your community. So you do what's absolutely necessary. What represents self-respect? Our lives matter. And we say that our lives matter, and we make that real by action, not just by talking about it. I mean, we can complain all we want, but we got to take actions that help us do that. And when we come back to work, we need to make it clear that these unsafe conditions will stop, because we will make them stop. It has to be different. We are never going back to what we faced in the past. Never. It can never happen again. And any leader of this union who's not down with that, who thinks that's too aggressive and militant and it might piss off the bosses, we need to throw them from the train. At this point, I want to let Seth talk, because we were supposed to go before me, but
yeah, I had a little technical difficulty.
Yeah.
Yeah, thanks, John. Yeah, I'm Seth Rosenberg. I'm a train operator in the B division on the B line, although the B line doesn't exist now. I'm currently out on vacation and was quarantined before that. Yeah, I wanted to talk a little bit about sort of connecting the dots with respect to the unsafe conditions we faced and the high infection rates, and then the damage control that Foy and Feinberg are trying to do. You know, it's really important that I don't know if people look there. Foy was on the Brian Lehrer show on WNYC, the radio show, a couple weeks back, and I was able to get on and confront him, and we had a little debate, although I was cut off at the end. And I think a lot of transit workers are really angry about how we were treated, and we really want to get our message out with respect to what happened, because Foy and Feinberg are in damage control mode. The numbers look really bad, and they are bad, but you know, their management and all they care about is, you know, covering the MTA and whatever it is, our lives don't matter. They want to keep running their service. And so sort of going into details about some of that, given that, you know, the New York Times article came out and Foy responded to that quickly, actually got the article changed in a number of ways. So I think the one thing to point out is that the MTA is trying to hide behind the CDC regulations with respect to saying they did everything they could, that they put their plan into effect. And we all know, anyone who works at transit knows that they're lying, that it's complete BS. Particularly, they talk about the masks. Now, first of all, their reading of the CDC regulations are in question. The CDC regulations themselves have been weakened, and we see that with respect to healthcare workers as well. Once this pandemic started, all of a sudden, the really strict things that kept people safe were out the window. But even more than that, I think it's really important to say that it's not just about the masks. Foy wants to hang everything on, yes, we followed our plan, but these CDC regulations, they just, you know, they let us wrong, and that's nonsense. The fact is that on a number of different issues, basic safety measures, the MTA did not take their own plan into advice and did not take the basic science and advice. Anthony, I think, spoke really well on, I've been pushing for, you know, almost a month now, just talking about sanitizing our positions. You know, they came out, they're so happy that they're sanitizing the trains every 72 hours. With a virus that spreads like this, every 72 hours, it might as well be every 6 months. It doesn't mean anything, right? When in our cabs, when 10 or 12 of us are using the same operating position each day, if one of us is sick, everyone's going to get sick. And when I was still working on March 17th, I confronted my superintendent on the B line, Superintendent Stallmans, and I said, you need to do some basic stuff to keep us safe. Otherwise, this virus is going to spread through the RTO crews like wildfire. You need to sanitize our positions after every round trip. You need to get social distancing in the crew rooms. If you can't do that, you got to tell people not to be in the crew rooms and find space for them. At that point, they still had people on the platform without masks, and we've seen what happened with that, right? And so when Foy says we took aggressive measures and we did everything we could, it's a bald-faced lie, an absolute 100% lie. And transit workers got sick and died because of Foy and Feinberg and the MTA superintendents and managers' lack of action. Bottom line, there's no way to argue with that. right? I have a Facebook post from March 18th where I documented my conversation with him. He actually told me when I talked about sanitizing positions, he said, you got to bring your own stuff and sanitize your own operating position. And I said, it's not my train. You're my employer. That's your job. And he said, well, we just disagree on that. And that's the MTA's attitude, right? And so then I wrote a letter to the union the next day. So all of this is documented, my conversation with him, right? Since then, we've been pushing for isolating operating cars, right? I wrote a letter to Patrick Warren, the chief safety officer of the MTA, that all cars that we use to operate in, conductors and train operators all day, need to be isolated. I confronted Chairman Foy about that. They're not doing it. The DC Metro is doing it. They're blocking things off on our buses, but they're not doing that. And a lot of our air comes from those cars. So, right, that's another exposure to get us sick. We also presented a plan. We sent it to Patrick Warren and to the MTA tops that if they aren't going to shut the system down, which I think we all agree now is the thing that's necessary. The MIT just came out with a study that's very strong evidence that the transit system is responsible for the massive spread of the virus. And the way that transit workers have gotten sick is even more evidence of that, right? But yet they continue to run things. And just to lay it out for, I think everyone who works for transit who's watching knows this, but everyone else needs to know, this is not a new thing. The pandemic has put it into clear light. But what we know, every transit worker knows in the core of our being is that when it comes to it, transit cares about running their service more than they do about our health and our lives, right? If we have to be sacrificed so that they can keep the trains running, that's what they're going to do. They've shown it before. I got caught out in a blizzard for 29 hours in 2010 because they wouldn't stop running the trains. And that's a little thing, but this is, right, 70 New York City transit workers, or, the numbers keep going up, dead, right? And they continue to run the system and not say, hey, maybe we did something wrong. There was a week back there when our infection rates were tripling every 2 days. That's more than any other group in the city, right? That's a smoking gun that we were not taken care of, that the MTA failed in its basic responsibilities to take care of us, and that we got sick and died because of that, right? That's blood on the hands of Chairman Foy, President Feinberg, Governor Cuomo, and every other manager and superintendent, right? There's no way around that. And our death rates have shown that as well. Now, you might hear people talk and say that, there was that, I think it's a shameful quotes from our union officers, Patafio and others, saying that the reason why we're dying in such numbers is because of our health conditions. If that were true, then our infection rate would be like everyone else's, right? But our infection rate is higher. That's why we're dying at a higher rate, right? If our infection rate doesn't depend on our health conditions, our infection rate depends on our exposure, right? That's the science of it. So we were exposed and not taken care of more than NYPD, FDNY, all of that. We were exposed at a higher rate because our executives did not take the basic steps like sanitizing, social distancing, getting us masks early, all of those things, right? And so that's where we are, and that's where we are today, right? And by continuing, we get reports all the time that, as Anthony was saying, we know how transit works. There's not soap here at this terminal. You can't get a mask there. Or we're getting one mask for 5 days, and 4 wipes or 6 wipes for a week? Right? The reason they're doing that is because they don't have the equipment to give us, right? There's too many of us to give the equipment to. And so they're like, well, we'll give them something and then say that that's enough. It's not enough, right? The people who are working right now are working in basically unsafe conditions. And every time, right, when you get done the day and you ask for another mask for the next day and they don't give you one, that's an unsafe condition. When you run out of wipes and you can't sanitize your position, that's an unsafe condition, right? When you're forced with an unsafe condition like that, we have contractual ability to file a safety dispute resolution form, and the work stops until a manager comes and signs off on it. And any manager who comes and signs off to make one of us work when 70 of us have already died, to sign off and say you should work unsafe during this pandemic, needs to know that there's going to be a reckoning and that they'll be held accountable. Their name should be put out to the press, right? There should be lawsuits against them, naming them personally, right? And the RCC should be called and the situation should be explained to them, right? We can't let these managers, we can't let MTA, we can't let Foy and Feinberg off the hook. Personally, I think, and I'd like to see it started soon. I think we need to start a petition among transit workers and other people calling for the resignation or termination of Chairman Foy and NYCT President Feinberg. They have failed us on every level, right? There's blood on their hands. Transit workers are dead, mass infection, incredible infection exposure rates, right? Under no measure did they do their job right. I'll leave it there.
Well, I just want to comment on some of what Seth had to say. I think we have to think about too, why they make the decisions they make and why they have such cluelessness and contempt for our lives. We have to understand who these people are. Sarah Feinberg is a featherbetter who has used political connections her entire career to work her way up the ladder of cronyism and patronage. She was a personal friend of Rahm Emanuel, who became Chicago's mayor, but at the time was the chief of staff for President Obama. Then she used her personal relationship with Andrew Cuomo to at 42 years old, think about that, at 42 years old with no experience running a major transportation system, she gets picked out of obscurity to be the person to replace Andy Byford, who, whatever anybody wants to say about him, there's no doubting his experience. There's no doubting his competency in running the system. And, this is society-wide. It's not just Trump who's unqualified. It's the entire capitalist class that's unqualified to make any decisions that affect human life because they just cannot be trusted to actually know anything about what it takes to actually do that. Sarah Feinberg, for example, she is famous on the MTA board for saying that she wanted to shame fare beaters, publicly shaming them. So I don't know what exactly she had in mind, whether we were going to pin them with the scarlet letter or what exactly do we have in mind. And that idea might sound good in the echo chamber of other morons who've never worked a day in their life, who've never dealt with the conditions that we all face. So, Foy's another one who started out at the Port Authority, has been using basically his political connections his entire career to get him basically jobs that he's not qualified for and that he uses to be a henchman for Cuomo. So,
to add on that, Pat Foy worked under Cuomo for the Port Authority, and he did not blow the whistle on Bridgegate. The New York faction of the Port Authority, they fell back and they allowed the Jersey faction to take the fall. Pat Foy knew what was going on, and he refused to blow the whistle. He's a lawyer. He worked for the Port Authority. It was his civic duty to blow the whistle, and he didn't. And he got another job. Once everything fell apart there, he got a job with MTA, and that's how it came through.
Yeah.
Boom.
And also, for Feinberg, Feinberg, she also pushed the 500 additional police officers. She was one of the biggest advocates for that. So at a time when we have supposedly there's $43 million available for this. Imagine what the $43 million could have done to provide the basic PPE that could have saved our lives. But no, Sarah Feinberg, in her infinite wisdom, decided that she was going to whip up on poor and oppressed communities and engage in retaliation against them to basically criminalize poverty. That's what she thought was a wise idea. So it's no surprise that when our members are dying, she puts out a live stream saying that don't listen to the haters, don't listen to the media. Oh, we're haters now? Our coworkers died. Haters? So we absolutely should start a petition to remove these people and to tell them that they must resign. But as much as I'm concerned about the MTA's leadership, I'm even more concerned about our own leadership. And the bottom line is that we need to look to ourselves as leaders. No one is coming to our rescue. We can only count on ourselves and our own ability to unite and to build the kind of power that can force the changes that we need to see. And I want members to know that you can reach out to Local 100 Fightback as a resource. We're here to help you. We do this on our own time. We're the ones who got the high quality masks for you. What did they give you? They give you paper towels and tissue paper and stuff that, you know, you're supposed to wear that for a week. You're supposed to wear a germ infected mask for a week.
Well, John,
Yeah.
what I from listening to everything that's been said, you know, just observing, you know, having been employed here for the past 13 years, when it comes to the things that you was talking about as far as protecting us, it goes to the intention. They have no intention of making it a priority to protect us. And what it is that our work, the work we do is essential, but they don't see us as essential.
Right.
They see us as being disposable. They don't see us as essential. They don't see us as essential. Being essential for our friends, for our friends.
Your audio is breaking up.
Yeah, I can hear it too. But
It's
what
better
I'm saying is basically that they do not see us as essential. They see our work, and the work that we do is essential.
Right.
Now, and our leaders, our union leaders, our elected leaders have shown that they really think they have no balls. They fall right in hand with management.
Tony, don't hold back. Okay?
They're not defending us. I mean, they should have been demanding, you know, that we have everything that we need to keep us safe. I mean, I put up a Facebook post. I'm not elected. There's not much I can do other than try and rally members to make the right decision and to try and call upon our leaders to make the right decision. But I put up a Facebook post a month ago saying that the system needed to be shut down. And you look at large crowds, if being in large crowds acts as it is transmitting this virus, you can't have a system like ours remain open and run business as usual and not expect for what happened to not happen. What they did and what they allowed, running the system the way they did, not putting protocols in place, is what caused what happened. It's caused every single death of transit workers. You know, I read that article about the MIT study, and Foy immediately debunked it. And
he tried to.
Yeah, well, he tried to. And then I think there was another MTA spokesperson who debunked that study. But they're not answering the question as to why New York City Transit has higher infection rates many times over than any other city agency. They're not answering the question as to why New York City is the epicenter of this outbreak in the United States. There's really only one element to it that is unique to New York City that isn't present in other cities. I mean, I'm sure after this is all said and done, someone will do a scientific study to figure this out. But the number one thing that they should look at is that we have a 24-hour subway system that carries millions of people every single day. There's no other social setting in New York City where you're as close to someone as you are on a packed New York City subway during rush hour. You could literally smell what the person next to you had for breakfast on a subway, a packed subway system. You do not really have that in most of your other major cities in America. Even within this city, I'm standing online in the grocery store. Typically, I'm not as close as I am to someone I would be on someone on the subway. In the park, I'm not that close to somebody. And the air is being recirculated in these cars.
Yeah.
It's a recipe for what has happened to happen. And if it happened because they didn't listen to us, the people who are in the middle of this. It happened because They really don't care about us.
Mhm.
And it's not just us. You know, you mentioned that you stood side by side with the nurses this morning.
Right.
It's a damn shame that in this country you have healthcare professionals going to work without the proper equipment. People putting on plastic bags to work in a hospital. It's a shame in this country. And every single one of these people who get up there and say that they're doing everything they can, I really don't know how they live with themselves.
Yeah.
I really don't know how they live with themselves when they're sending people out into this Chernobyl,
Yeah.
to contract this disease without the proper equipment. How can they live with themselves and stand there and say in front of God and man that they're doing everything that they can?
Yeah.
It's shameful. It's very shameful. Yeah,
Umberto, sorry.
I just want to make a few points. I actually have to sign off, but
Yeah, we all gotta go soon.
another thing that we didn't mention was our brothers and sisters in buses. Like buses has the highest rate of death. We have the highest among bus operators, and that the little chain and whatever they're doing didn't really help. Like they're exposed. They're dealing with the fare box. They're dealing with passengers right in their face, 24 hours a day, and they've been ravaged. Like it's unbelievable, like the numbers, and it's not fair to them. Like we have to also include them. They've been ravaged and they've been ignored, and you know they took a while for them to put the little chain on the whatever the partition. Well, it's not a partition, it's a chain. Literally, it's a physical chain, and I don't think that's done anything. Like, you know, like you said, we need to disinfect the buses, and we have to have a better system. Like people are dying. So I mean, like the system is the train and it's the buses. Like we have to, like you said, we have to unite with the bus operators.
Mhm.
You know, Patafio failed them. Like, you know, the leaderships failed them. And to another point, like we're talking about the nurses. It's interesting with tier 6, the nurses pled with Cuomo to request status. What was it called? Because I think their retirement is 30-65. So they wanted physically taxing status so they could retire early. And this is how they repay them. The Cuomo calling them heroes and saying this and that.
Yeah.
You know, he can't even give them a fair contract or a fair pension. You know, and it's a shame what's happening to, you know, and it's like I said, COVID is exposing everything, whether it's macro, micro, it's transit, healthcare. We didn't even get to essential workers, Amazon, people that work grocery stores. Like it's like I said, it's affected everything on the macro, the micro level.
Yeah.
Anyway, I'm gonna let y'all go. I have to get going.
No, understood. We're gonna be wrapping up anyway soon. So can you hang for like a minute or two?
Definitely. Yeah.
All right. So yeah, I just wanted to get to one other point that we didn't get to about Cuomo, just to show you like what a immoral, heartless bastard he is. Cuomo is responsible for a budget that cuts $2.5 billion out of New York City hospitals. That's going to mean hospitals will close. It's going to mean less beds. He's also collaborated with the hospital executives, you know, the ones at Mount Sinai that are chilling now in their mansions in Florida while nurses are dying. He helped them cut over 20,000 beds. So when he cries his crocodile tears about, oh, we could have never prepared for this, and we need more beds. Now he said we need 110,000 beds. Well, New York was down to like 50 or 60,000 because of him. So he has blood on his hands. You know, don't let him fool you with this. He's a competent leader and he feels our pain. Bullshit, because that's exactly what it is. Also, station agents. Think about the contempt. Think about the absolute disgusting lack of concern for human life that it reflects for the MTA, who got rid of fares on the buses to continue to put those station agents in danger every day for no reason at all. No reason at all, except to try to get as much from the fare box as possible. Think about like the moral depravity of that. And, you know, like, you know, we could call out Patafio and company, but Wichard is an absolute disgrace. What the lack of leadership he's provided in stations. So that's another issue. But I wanted to wrap by saying, look, reach out to your coworkers, reach out to activists like Local 100 Fight Back, Canela Gomez. There are other people who are resources who you can reach out to. You are not alone. Please don't wait for a rescue from your union leadership, because it's not coming. Okay. We are the union. Look to each other. We're the future, and that has to happen, or we're not going to have a future. So we look forward to hearing from you guys. We want to hear all your comments, and we will try our best to respond to them, but you can hit us up individually anytime. Anybody else got something to say? We all good?
Yeah.
All right, it's getting late. We don't keep
Yeah.
you too late. Okay, we all good?
There's always
Yeah.
more to say. I'm gonna
we
call
could
it
be
a
here-
night.
We
Yeah.
could be here all night. Yeah, we could be here all night, man. Like, it's a lot to cover, but we want to try to give you guys a nice, concise
Right.
wrap up, so you don't, you want to watch a 3-hour video. I know a lot
Yeah.
of us are at home, but yeah.
Also, just wanted to say that this is not going to be the last of the live streams that we're going to do. We're going to try to do it on a regular basis, because it's a good way to connect with people. And like stuff I learned stuff tonight I would have never known about Steineger's experiences, about Umberto's experiences, and I thought that was really important.
Oh, I did want to say one thing, John.
Yeah.
I don't know if you've been following the comments at all. This is our first time doing this live stream, so I know people have asked some questions on the side, and I think as we do this again, we'll be able to interact with you in real time better. I think we're still trying to get our feet under us, but if you look at the comments, I don't know if people know that conductor Ben Schaefer is in the hospispital.
Wow.
He's in the ICU, in bad shape,
Shit.
and needs blood, A positive.
Oh, they need donors.
Yeah, so I saw that, and we all know Ben. He's a sweet guy,
Wow.
and we wish him the best. And everyone should send their thoughts to him with respect to his recovery. And if anyone is A positive or knows anyone who's A positive, he's at Maimonides Hospital, and he needs our help. So,
Okay, yeah, definitely. Yeah, we'll put that out there. Would like to wish everybody a great night, and we'll be in touch soon, and feel free to reach out to us. Local 100 Fight Back is always available. Always here as a resource. We're here for you. Okay. Thank you so much for tuning in.
All right, everybody, be safe.
Safe.
All righty.